As you may know, hypertension is a serious medical condition, one of the most common chronic medical conditions that affects millions of people all over the world, irrespective of race, age, sex, gender, or even wealth status. Despite this prevalence, there are a number of misconceptions that people have regarding this condition. In this video, I will be debunking some myths about hypertension, as it is important to separate facts from fiction, especially regarding your health. As a medical professional, I will be offering to you the important facts that you need to know. We'll share some in this first part of the video, and I will share the remaining in another part of the video. There will be a part 2 of this video. So let's go. Firstly, there is this myth that hypertension only affects older people. Interestingly, many young people think this way, but we have finding out that there are even younger people that are developing hypertension. So hypertension can occur in children, in young adults, in middle age, and older adults, even in the elderly. So hypertension can occur at any age. Another is that if you feel fine, it means your blood pressure is good. No. Hypertension, also known as the silent killer, have you heard that before? An individual can have hypertension and not even have any symptom, and such individual may even come up with a sudden event, a complication like a stroke or a heart attack, because of this level of blood pressure, significant enough to cause this complication. Another myth regarding hypertension or high blood pressure, which is closely related to the second, is you can't have hypertension if you are fit. No, fitness does not guarantee normal blood pressure, because hypertension has a multifactorial cause. It could be genetic, and then there is the environmental factor. The fourth myth about hypertension is that salt is the only cause of hypertension. Some people believe that intake of salt, especially the table salt, is the major cause of elevated blood pressure. No. Other dietary abnormalities like excessive intake of sugar, excessive intake of fats, especially saturated fats, excessive intake of alcohol, excessive intake of many other forms of food, fast foods, junk foods, processed foods, and even intake of seafoods can elevate an individual's blood pressure. Next is hypertension is always caused by stress. I have come across patients who say, "But doctor, I'm not worried, I'm not stressed. How come I am having elevated blood pressure?" Yes, because stress is not the only cause of hypertension. Even though physical stress, mental stress, emotional stress, and other forms of stress can trigger or worsen hypertension, however, stress is not the only cause of hypertension. The next myth I'm sharing with you about hypertension is that you can stop your medication since your blood pressure is now normal. No. There is a need to follow your doctor's prescription and ask for a necessary review if there is a need to adjust your medications, because hypertension is a chronic medical disorder, and any individual placed on medications is expected to take this actually for life. Though there are rare occasions where adjustments may be made in the dosage or even in the medication use, the type of medications, and then there may be a need for some people to actually stop where there are cases of recurrent hypotension, or the doctor eventually finds out that this patient or individual would not benefit from continuing intake of antihypertensive. So I get this a lot from interacting with patients. I hear patients say, I have not used my drug this morning because my blood pressure is now normal. I do not use it when it's normal. No. You should use your medications. It only means that your medications are working well to maintain your blood pressure. So when you stop, what happens is this: some people end up coming in with complications because your blood pressure, especially when not monitored, can be so elevated as to cause a complication like a stroke, which can even lead to death. I'll be doing a video on stroke very soon, and you will need to watch that video. Stroke, which is one of the complications of poorly managed hypertension. Another false belief, another myth about hypertension is that only men have or get hypertension. No. Irrespective of gender, as I mentioned earlier, there is a multifactorial factor to development of hypertension. So whether a male who has the genetic factor and the environmental factor, and a female who has the genetic factor and environmental factor, if these are present, any of the genders can develop hypertension. So it is irrespective of sex, as mentioned earlier. Women are also especially at risk after menopause. Another myth about hypertension is this: since hypertension is hereditary, there is nothing you can do about it. No. Hypertension can be managed. It can even be prevented using lifestyle dietary modifications that can help prevent the development of hypertension. So lifestyle changes can help to reduce your risk of developing hypertension, and that is a significant one. Even those who are being managed for hypertension have lifestyle approach even to their management, aside from taking medications. The ninth myth about hypertension is that drinking coffee causes hypertension. The fact is that moderate coffee intake doesn't have a lasting effect on the blood pressure for most people. Finally, in this part of the video, the last myth about hypertension is that you can rely on home remedies alone to manage your blood pressure or hypertension. No. Even though some home remedies are good for supportive management of hypertension, home remedies alone are not enough to manage blood pressure, especially if you are already on medications prescribed by your healthcare provider. So which of these myths have you had, and which one have I debunked for you? You can drop in the comment box. Let me know what you have believed about hypertension and what you now know as a fact. Thank you for watching. See you in the part 2 of this video, and there are other related videos on hypertension which are available on the channel. Remember to watch them and put in some action to the management of your blood pressure if you are hypertensive. Put measures to prevent developing hypertension if you are not hypertensive. If you know someone that is hypertensive and that will need this kind of video or channel to help them, then why don't you share with them this video, share with them some other videos on the channel, share with them the channel link so that they can subscribe and get regular updates, professional information on health, wellness, and lifestyle. Thank you for watching. Thank you for subscribing. Thank you for sharing. See you in my next video. Stay healthy, keeping fit.